My name is Rachel, and I did my assessment presentation on the Craig Handicap Assessment and Reporting Technique, or CHART. The picture is just an example of the assessment. There are several authors. The original assessment was written in 1992, and there was a revised version written in 1995, which is the one we'll be focusing on. There was also a short form that was written in 2000. The publisher is the research department of Craig Hospital, which is located in Englewood, Colorado. It cares exclusively for patients with spinal cord and brain injuries. It takes about 15 minutes to administer this assessment. There are 32 questions total and 6 domains, with a few questions per domain. The maximum score per domain possible is 100, which would be a non-disabled individual. The minimum score per domain possible is 0, which would be a max handicapped individual. And here's another example of what the assessment looks like. Typically, this assessment would be used with those aged 18 and older, and also mostly with spinal cord injury patients, but it's also been proven to work with traumatic brain injury, MS, stroke, burn, and amputation patients. It's been translated into 5 different languages: Spanish, Japanese, Chinese, Korean, and Italian. The purpose. The Craig Handicap Assessment and Reporting Technique was developed to assess the World Health Organization dimensions of handicap. The instrument was designed to provide a simple, objective measure of the degree to which impairments and disabilities result in handicaps in the years after initial rehabilitation. Areas assessed: orientation, physical independence, mobility, occupational functioning, social integration, and economic self-sufficiency. The assessment is written in an interview style, and you would typically administer this either in person or over the telephone. We know as OTs that you typically receive more valuable information this way, and you can really observe the individual. But it's also possible to use the mail-in method, which isn't as reliable because some information may be lost. You may use a representative for the patient if the patient isn't available, and you would typically calculate scores when the interview portion is complete. CHART is a standardized assessment. The validity is high for those with SCI, and the reliability for inter-rater and test-retest is excellent for those with chronic SCI. Cons of this assessment are that it focuses a lot on societal logistics and not as much on hobbies or personal interests, and it may be confusing to those administering the assessment because of the way the scoring is, which we'll see a little bit later. Pros are that the CHART assessment assesses community integration. It uses the same areas as the World Health Organization, but it defines them in measurable terms. It covers many domains, and it's written in 6 languages. There's also a recent development, as I mentioned earlier, of a short version which has 19 questions instead of 32. The case study I came up with is that Tom is a 22-year-old patient that suffers from a spinal cord injury as a result of a motor vehicle accident. He was discharged a year ago, and he lives at home with his parents. He's an incomplete T2 to T4 paraplegic. He worked out daily prior to his accident, so he has good upper body muscle strength, and he has continued exercises after his accident. He's independent with most transfers, cooking, personal care, and driving with hand controls. So he would probably have a score of around 450 to 580 out of 600 because he still has good upper body movement, and he's very independent in most ADLs and IADLs. For more information, you can always contact David Mellick at Craig Hospital in Englewood, Colorado, which is the hospital that published the CHART assessment. The cost is free. All you really need is a pen or a pencil. You can download it at this website. If you really wanted to print it out, you could print it out probably for $1 for all of the pages. This is what the scoring sheet looks like. You can see on the right why I said it might be a little bit confusing if you aren't shown properly how to do this assessment. And these are my references.